Good evening, all. Welcome to yet another interesting um, academic meet. I welcome the president, Dr. Sabrin. I welcome the other office bearers. I welcome the executive committee members of TNIPS. And on behalf of Women Empowerment Committee, we welcome you all. Today is a very interesting topic, psychological keys to healthy relationships. Short introduction to the topic. Actually, a few months back, when we committee members were discussing about what topic we can think about, we wanted to do something for the mental health of our young fraternity, the medical students. So, amidst the various challenges these students are facing, be it the excitement, the gaining knowledge part, new experiences, responsibilities, and all this stuff, what we felt was in day-to-day practice and in many other settings, we have seen our students coming to us seeking help for some kind of guidance, be it counseling or a consultation or any form. So in some way, it's just going to be a distraction when it comes to relationship issues. For some, it leads on to major stress, depression, adjustment disorders, and complications like that. So we thought rather than discussing about the various disorders, the complications, management, we can focus on something prophylactic where we can give them some keys or tips which can guide them in taking these things in the the healthy ways of coping that phase of the challenge, the relationship part. So hence we thought this topic would be very useful for that. I now welcome our President, Dr. Sabrin, to say a few words about this thing and to start the meet today's meeting. Welcome, Dr. Sabrin.
Good evening,
Over to
everybody. I thank the Women's Empowerment Committee, especially under the leadership of Dr. Mathi, Dr. Abdul Rahman, Dr. Bhagyashree, Dr. Janaki, to really think about and come up with innovative topics every now and then. I think you'll all remember the last meet was on sexual harassment at workplace. That is something that all of us should know to remain safe and understand situations. So that was the previous meet. And now we are talking about another topic that is very important for all of us. And it is, as Dr. Bhagyashree said, we are trying to prevent a mental health issue. And where better to start prevention than at home? At home means our very own doctors, MBBS students. And our students are, or all of us are doctors, from budding doctors or forming doctors. We are all human beings. And more than most people, we face a lot more pressures than many other non-medical people. And among these pressures are a relationship. And college time is where a relationship starts getting formed, friendships and various relationships. A relationship among same sex, among opposite sex, and everything. And unless people know how to navigate it and handle it properly in a healthy manner, we may end up with mental health issues. And so I really appreciate once more the Women's Empowerment team for thinking about this topic. And I really welcome our past speaker, Dr. Usha Nandini. It's going to take a long time, and I think it's going to be tough to introduce her. Still, I welcome her, and looking forward to listening to this very, very interesting, useful talk that all of us need. So once more, thanks for organizing this meet, and welcome all of you to this meet.
Thank you, sir. Thank you very much for the appreciation and introduction of the topic and program as such. So now it's time to introduce the speaker, Dr. Usha Nandini. So Dr. Usha Nandini from the medical field, actually, I thought she's little new to the field only 2 years after her MD and all those things. But when I gone through her CV, I felt how much in-depth knowledge she has in various aspects of psychiatry and how much she has contributed already to psychiatry field. All those things I could. Dynamic, compassionate psychiatrist working in the field of clinical practice, research and education. Usually we tend to choose either one of these field, but she is in all these fields. Currently, she is in working in very many hospitals. I don't know how she finds time. She says she has 2-year-old kid also. So how she is balancing this work-life balance, even for doctors, especially psychiatrists also, it is difficult. And from the time of medical residency itself, she started teaching others. That is one thing. She worked in various setups, government setup, corporate setup, private setup, everywhere she has worked. So that is one of the important thing. Apart from that, what I find is she seems to be a good writer. So she is a blog writer, director of Lexicon in .com, and India Medical Times freelance journalist, and gpclinics.in freelance journalist, and health mir content writer. So this is, I find, little amazing. And also she got awards and certificate from various areas: rtms, cds, neuromodulation training workshop, sexual medicine course, remedial instruction for special learning, and she seems to be a university medalist in her MBBS period itself. And she seems to be Youth Ambassador Award winner for the essay on how to deliver primary healthcare in 21st century at the Family Medicine and Physician Conference at New Delhi. So these are some of her awards. So many research activities she has done, and proficiency in 4 or 5 languages, including Hindi and Malayalam. So she's a good teacher and good orator. And Suresh Kumar sir himself appreciated her very much about her potential. So with this brief introduction, I welcome Dr. Usha Nandini, and also seems to be very flexible and accommodative. We want to do this program from January 1st itself, and this was getting postponed very many times, and every time she was very accommodative and adjustable. Thank you for very much for that also, Doctor. So I welcome you to the speech, and just please proceed. Thanks for accepting our
Thank you,
invitation.
ma'am. Thank you, ma'am. Thank you so much. So the CV was prepared for me to get a job. So there will be a lot of things in it. So ma'am has been kind enough to share all that. So I'm just sharing my screen and we'll get on to the topic. Hope my screen is visible.
Yes, ma'am. Yes, ma'am.
Yes. So psychological keys to healthy relationships for medical students. This topic was convened in such a way because we wanted to restrict the audience to medical students, and like ma'am and sir, everybody said, everybody comes with some or the other relationship concern, right? The moment you say I'm a psychiatry resident or I'm interested in psychiatry or you're a psychiatrist, they will be like, okay, I have this problem. My boyfriend is not talking to me, or my girlfriend is not talking to me, or whatever. I have undergone a breakup and everything. So this seems to be a very important area and also a stressor to precipitate various psychiatric illnesses. So this is also a preventive aspect, like Sabrin sir also mentioned. So how I'm going to present this is, in a slightly interesting way. So let's just get on with it and see where it goes. Right. So for students who are attending this webinar, just to make it a little more interactive, you can just open your Google Chrome and type menti.com. A window will open, and in that window, you can just type on this code. Just 1 or 2 interactions, because this is a relationship webinar, right? And I cannot ask how many of you are in a relationship on the Zoom chat link, and maybe your professors are also here, and you might get into trouble. So I wanted to maintain that anonymity and wanted to enhance the participation. So I just tried to do this, right? So you will get the screen, and this is the first question. You can just select yes or no. Do you have any relationships? So there are around multiple participants, around 50 participants have joined. So I've got one answer saying no. Right. A few more answers. Yes, yes. Just looking for at least for 15-20 answers, so that we'll just go into what I'm trying to say from this particular slide. Yes. So the time is 8:41. I'll just wait for 1 minute. 8:42. We'll just move on. A lot of people are saying yes and no. Right. You just have to type in www.menti.com. Go in, type this code 83688451, and you will get the screen. Around 7 people who have joined the link and they have answered. Majority have answered no, and a minority have answered yes. So in 7, the majority and minority are just 3 and 4. So yes, the time is 1 minute. So let me just go into the next slide. I'll try to make the point what I'm trying to making. So 4 of them have answered no. But what I was asking was, do you have any relationships? Not are you in a relationship, right? You have other relationships, you have your family, you have your friends, you have somebody who you bunk classes with, for example, so that are also relationships, right? So are you in a relationship would be a little more sophisticated answer for a romantic relationship, right? So this is just what I wanted to convey from this slide. So going back to my presentation, so these are other relationships. So the father-son relationship, or right, just like this, and a very happy romantic relationship, like we have seen in this. And very bad. Romantic relationships can be good and bad, right? So there are also toxicity that comes out in relationships more than any other place. So the overview of my presentation will be like relationships and medical students. Why is it important? What are the types? Romantic relationships, narrowing it down to our problem area. So what happens when this one consumes all other relationships that we have, right? And what are the certain psychological, technical terms to make it a little more sophisticated? Ego, superego, the relationship angle. What are the certain attachment styles that we can understand, and other certain psychological aspects to navigate the relationship dynamic. And the most important topic of such a relationship webinar would be how to handle a breakup, right? So let's see how it goes. So like our president Dr. Sabrin sir mentioned, as medical students we suffer specific challenges than any other profession, right? So we have long study hours, we have very high levels of stress because of the rigorous academic demands, and the emotional burnout is unimaginable. I mean, I'm not saying other courses are easy, but still this takes a lot of mental bandwidth. And also the competitive environment, the close friend or even your boyfriend or your girlfriend is also a competition to you when it comes to ranks, when it comes to NEET PG preparation, for example, or when it comes to getting a job or getting a seat, etc. So the interpersonal struggles between peers are very, very high in our field, right? So just to have a small review of people, right? I know the audio is not there, but you can just have the look. This is how the world views, but no. You can imagine how in an anatomy dissection table you have certain partners, right, to take care of you, at least not from fainting. And when it comes to a physiology lab, and somebody who gives you blood, right? So all of these are also relationships that we have in medical college, right? Because these relationships help us with the physical exhaustion, to make it a little more supportive. The support system is what is given by these relationships. So what are all that they give professional development, they help us in our personal growth. They'll be like, okay, it's okay. Today you did not get the answer, right? Today the doctor pointed you, the teacher pointed you and asked you a question and you did not answer. It's okay. Providing an emotional support. Okay, I understand that things are hard at home. Let's talk it out. right? That kind of emotional support. Let's collaborate for a research paper. I also want to do USMLE. I also want to go for UK PLAB examination. So we need to have strong research background. Let's collaborate together and do research. And come on, I understand that you're having fever today. Let me take a box of lunch from hostel and keep it for you, the support. And also, I'm not able to understand this biochemistry topic at all, right? You seem to do well there. Can you help me? The enhanced learning and the community. You can see how doctors stay very community oriented. There are lots of alumni meets. There are lots of batch meetups that happen even 20 years later, 50 years later. This strong sense of community is because of the relationships that provide the sense of warmth and the support to survive in such a cutthroat competition, right? So if you look at this video, to have a hostel roommate, let's say, or to have a partner who bunks with you and, in a very difficult situation helps you hide a dead body, let's say, not in a literal sense. And also, sometimes we also forget that we also have a relationship with our patients. So every patient that we take history of, the patients who come to our exams, everybody are also having a relationship with us. They also help us in a lot of ways, right? So just coming to another mentee topic, just go back to that, name some types of relationships. So now that we have seen there can be various relationships that we can have in a medical college, and it is not just romantic relationships, and every relationship has its own role. Just think of some types of relationships that you have in a medical college, and you can type it out. Let me see one or two words, and then again it's 8:48. We will take 1 minute, 8:49, and then we'll close it. For better sense of time. So this is completely anonymous. Yes, student-teacher relationship, senior-junior relationship, friends, romantic, patient, anything else, fun, fancy, something interesting, like, somebody who helped, help you with something specific. I would say some people have sports buddies. They always go play with that particular person, even though they are not close to each other in other aspects. Some people have a library friend, right? So, yeah. Right. So this is what I'm trying to convey, that there are multiple relationships, and each of it, mom, dad, yes, thank you, mentor, yes, thank you. So these everything has its own role to play in a student's life, in everybody's life. But since we are restricting ourselves to students, so this wheel has, like, see, let's say a desk partner, a lab partner, a study partner, a clinical posting buddy will be like, why don't you help me with this case? I do not know even what to ask in a history taking. I have to present the case tomorrow, and they are in the final year in the exam going batch. So those people are also there, and the friends help out. So they have a clinical posting buddy, they have a study partner, they have a hostel roommate, everything. But the problem arises when this particular romantic partner, this romantic partner takes precedence, and the entire wheel is consumed by this romantic partner. Just imagine so many roles to be played by so many people, and you want that but one particular person whom you fall in love with, for lack of better words, or you start dating with, or you start going out with, or you just trying how this works out. That kind of romantic partner, you want them to be everything in the social dynamic of a medical college, and you can imagine how much of pressure that would put on that person, on that relationship, how it can strain and how it can affect you in return, right? So just another thing where, let's say, what happens when the romantic relationship consumes all other relationships. This is my final Mentimeter slide. So if you are frustrated with it, so this is the final Mentimeter slide. So just one or two words. What happens? What do you think that happens when a romantic relationship consumes all other relationships when it comes to a medical college student? Just go back to menti.com again, 1 more minute. 8:51, we'll wait till 8:52 and then go back to our slides. Anybody? Decreased performance, yes. Clinginess, misunderstandings, excessive scrutiny, thank you, stress, unable to cope up. So these are the various things that happen when one relationship, that is the romantic relationship, no liberty to talk to others happens, possessiveness happens, loss of friendship, very, very important thing to happen to a person who is very sociable, very active social life, and suddenly they get committed. That's the word they use. Suddenly they get committed, and suddenly there is nobody else they go out with. They are like, I do not have time for my friends, etc. So this happens, and this actually looks like it is okay. So I have somebody that I can share my life with and everything, but this itself causes a lot of strain in the relationship per se, right? So it could be just like, if you've seen the scene, you would understand how clingy this particular character is. Right? She'll be like, every day morning, from morning till night, you have to talk to me, and at night also, you should just think about me. You cannot go out, you cannot study, you cannot do anything else. Right? So what happens? There is this relationship takes precedence, there is intense connection, obviously, right? And also this, there is emotional fulfillment from this intense connection, but there is neglect of all other relationships that take place, and it puts a very big strain. So yes, now that we have understood the various relationships and how a romantic relationship, when it consumes all, so how can we navigate this relationship dynamic, which is our original topic? So this id, ego, and superego are words used by a famous person in psychiatry, psychology. So for people who do not know, so it's just a famous person in psychiatry, psychology. His name is Sigmund Freud. So he was the father of something called as psychoanalysis, which is one form of psychotherapy technique. Okay, so what he identified was that this ego is not equal to the ego that you see. Like I am a very egocentric person. I am a very ego person. That person has a lot of ego. Ego pudicha ponnu, ego pudicha paiyan. No, not that ego. This is kind of a reality, right? So when we are born as babies, we are born with certain instinctive desires, right? Like the baby doesn't know anything. If it wants something, it wants. It wants milk, it wants its mother, it wants its father, it wants to do something, it wants. So until a very, very late age, we still want things that we want. We do not understand why things are, not given, etc. So that is basically a pleasure seeking behavior, a very impulsive behavior. So to give an example, let's say a person is a diabetic person and they see a chocolate cake or a biryani and they immediately want to eat it because it is their instinctive urge. I see a chocolate cake, I have to eat it because it gives me pleasure. Right. So in a relationship point of view, this can be like, I want you. I want you today. I want you tomorrow. I want you next week. I want you for the rest of my life. Something like, a very impulsive thing. And it can lead to a lot of pressure on the other person. It can lead to a lot of instability in the relationship. How? Because if you think about only what you want and what the other person thinking or whatever the other person is going through, that can put a lot of strain, right? So it is like, I want to. Whereas superego is the exact opposite. So when I coming to a diabetic person analogy, it is like the doctor has told me you should not even take one pinch of sugar, then you will die. So the doctor has told me, so I have to follow it. Right? Superego is something like, when we are growing, we look at various religious principles, we look at various heroes, heroines, various inspirations, and we follow their rules and identify what is right, what is wrong. This societal influences in a particular child as it grows is called as superego. So when we are growing up, there is id on one side, there is superego on the other side. Both are pulling on the opposite extremes. So in a relationship dynamic, it will be like the social norms, the ethical standards, something like a caste angle, for example, something like a topper in relationship with another topper, and when that the romantic partner gets let's say an internship, an internal exam fail mark, and they are not able to accept that kind of, the societal standards kind of thing, right? So what I should do in a relationship is based on what I know about the society's influence on my own brain, right? So what I want and what I should is pulling me apart, and what I really do or what I can do is what the ego does. So the ego is actually your own personality. So how you balance this id and superego, creates your reality, creates what you decide, creates your own, your own personal sense of decisions, rights and wrongs. That is what you can do in a relationship. So let's say somebody you are going through something like, okay, I'm in a relationship, so I want you to do this, and that particular person is saying, no, I have a posting tomorrow, so I have anesthesia posting, I have to go into the OT, I'm going to be given intubation chance, and you are like, so you don't want me, is that what you're saying? No, you have to also understand this balance. So this balance comes when you understand this kind of relationship dynamic, right? So this romantic relationship is just one part of the balance. The opposite part contains all other relationships which provide social support and shared responsibilities. So I keep on telling this, romantic relationship is one part. There are also other things that other people play in our life, and there are also other things like career, for example. There are also other things like our parents, our responsibilities to our parents, to our siblings, to our teachers, to ourselves, and also to our romantic partner. So this is just one part. But when we just avoid all these other things and concentrate on this one particular part, it will also not go good, right? And it will also affect everything else. So there needs to be a balance, and that balance can be found when we understand what we want and what we should do, and find a balance between them and find out what we can do, right? So another psychological concept that I wanted to introduce is called as the attachment style. Attachment style is another, again, a very old psychological principle given by very famous psychologists like Mary Ainsworth, etc. So what they basically say is that you would have seen a lot of movies. So everybody, they will show a past, flashback and say their relationship with their father was like this. That is why they are behaving this way. Their relationship with their mother was like this. Even in KGF movie, the mother's voice keeps on coming back and telling him do this, do that, etc., etc. So this attachment means when a baby is born and it gets attached to its primary caretaker, which is usually the mother, or a grandmother or a father. So this primary circle, how they get attached to this baby and how they respond to the baby's safety needs, hunger needs, everywhere, if they are consistent, whenever the baby is crying, are they consoling them? Whenever the baby is hungry, are they feeding them? So this kind of a predictability in that relationship will give them a psychological security, and that is called as secure attachment. So when a particular person has a good childhood, for example, for better words, a good childhood, they have a secure attachment. So they will be again with their romantic partner also, their attachment will be comfort, and they will have very good communication, they will have very mature way of dealing with conflicts, etc. And that secure attachment is our goal. So it is not that attachment cannot be changed, so how their childhood cannot be changed, but with support, with certain sometimes psychological aids, sometimes with a lot of reflective practices and a lot of your own self-awareness, we can try to change other attachment styles into a little more secure attachment style. So what are these other things? So anxious attachment style is where the when the child is crying, sometimes they give excessive milk, sometimes the parent is like taking the child everywhere, giving it every safety and comfort that it needs. Sometimes they are neglecting the child's needs, sometimes they are like, let her cry or let him cry to sleep, or there is no milk in the house, so let him cry to sleep, in a poverty kind of situation. So in that way they will have unpredictable expectations. So their expectations sometimes are solved, sometimes are not resolved. So these kind of children go on to develop anxious attachment, where there is a fear of abandonment. So they'll be like, what if this partner also leaves me? What if this partner also does not take care of me? What if they also not satisfy my needs? Right? So what if this goes wrong? So this kind of fear of abandonment results in a clinginess. That is where you have to wake up, talk to me, you have to eat, talk to me, you are sitting, simply talk to me. How can you watch a movie without talking to me? How can you spend time with your friends without talking to me? That kind of clinginess comes from an anxious attachment style. So if you are aware of these styles, either you can understand your partner better, and you can also help them to get over and develop better coping skills to come to a better attachment style, and you can also seek help when necessary. So this kind of understanding will really change the relationship dynamic. And if you are a person with anxious attachment, now that you realize, you can work on yourself to change. Then the other thing is that avoidant attachment. Again, in this case, the parents would be neglectful. They are not taking care of the baby at all. Like they are not in a position to take care of the baby, maybe in that kind of way. So it's an avoidant attachment style where the person will be like always maintaining an emotional distance. These are the people with a fear of commitment kind of things, and they will suppress their emotions. They will be loving that person so much, but they will not be able to express it in words. So you would have seen in certain movies the love languages are expressed. So some people require that words of affirmation, some people require that gifts, some people require certain emotional connection. All of these they will not be able to provide, even though they like that person, even though they want to do it, they will not be able to provide because of this kind of attachment style that is grown up within them, right? So in order to understand this, and in order to reflect upon it and change themselves towards their partner, what the partner wants and what I want, that kind of talk, that kind of communication can better a relationship. Another thing is avoidant attachment. Again, here also, so they will have very instant, they're fearful, right? And they sometimes it's like I love you, sometimes it's like I hate you, and sometimes it's like do I really want to be in a relationship with you? So this kind of instability also happens. So these are the various attachment styles, and based on this also the relationship dynamics varies. So from your point of view, like what is the point of knowing this, ma'am? Why should I know this? So when you know this, you will understand why the other person is doing certain things in this way, and why are they not understanding why you are going through this. So this will help you, you know, to have a better communication, a better a better empathetic listening to them, and can change your relationship dynamic to something better, right? So in this video, again, they would have told you about secure relationships. I'm so sorry that the videos are not playing. So it's like we always expect the other person to be truthful and etc. etc. But we do not introspect and change ourselves. That is important. So self-awareness is very, very important for a relationship to survive. It doesn't even matter for a romantic relationship. Even in a friendship, you should be self-aware. You should be able to understand your own emotions. You should be like, okay, I am not in a position. I am in a very frustrated state. I'm not in a position to provide myself. For this friend lending year, I cannot come to this party and be that fun-filled, bumbling ball of joy. I am in a very frustrated state. So if I understand my emotions, if I understand my triggers, my needs through reflective practices, then I'll be able to better bring things to the table of relationship. So on that day when I'm having a bad day, let me not come and meet you and make you also in a very bad mood. That kind of thinking, right? So again, other so things like communication through empathy and empathetic communication. What is empathy? Since again you're all medical students, so empathy is putting yourself in another person's shoes and understanding. So if my girlfriend is saying that she doesn't want to talk to me today, why is she saying that? Is it because she hates me? That is my immediate thought. But what is the better answer? She's also going through her periods, for example. She's going through a phase where her parents are separated or undergoing a family conflict in their family. So let me be there for her instead of blaming her for not talking with me, not spending time with me. Or if she or he is in a conundrum and they want to talk to somebody and they choose you to talk, and you have to be willing to listen actively. So what half the time what happens is, okay, they'll be coming like, I have this problem today, and you immediately give them a solution. Go do this, go talk to this professor, tomorrow the problem will be solved. No, they want a person to listen to them. They want a person to rant. They want a person to understand that they are going through something. They do not want a solution all the time. This holds good for both male and female. So half the time we'll be like, okay, females want this. No, male also want to be listened actively. They also want somebody to rant with. And when you are communicating in a, let's say, in a conflictive situation, like you are going through something difficult and you want to, you're angry with that person, and at that time you have to be very careful about how you are expressing it, what are the words you're using. This is very, very, very common even in very young children, 17, 18 years, entering into college. They get into violent communication. They'll be like, enna kutta varmatya, a beat on the head or beat on the shoulder. It starts like this. It ends up in a very, very violent, toxic relationship. Sorry to say, it happens, and we see a lot of people in such relationships, even among medicals, right? So that particular girl or the boy would be the best in his career, would be a best surgeon, best physician, best physician, whatever. And in their family or the person they are in the relationship with, they cannot express that that kind of confidence, because it is a toxic relationship. Whenever you are like, okay, I did this, I got this win, and they'll be reacting in a different way, and that becomes a toxic relationship. This kind of behavior needs to be identified. If it is within yourself, you need to work on it. If it is with your partner, you also need ask them to work on it, and make sure that you are not getting into that loop of a toxic relationship. So for all of this to happen, if you are, if you are a person who's a very introvert and you do not know these skills, you can use a lot of role playing activities. Even if you come to a counselor or a psychiatrist, we also use these techniques to improve your communication skills, listening skills, etc. Right? And boundary setting. How would boundary setting help in a relationship? Again, relationship is not the only part of your life, right? You also have your medical career. You also have to prepare for USMLE, PLAB, NEET, PG, whatever. You also have to prepare yourself for a very challenging practice, right? And if you keep on be, always just being in the, just talk to me, etc., whatever, and then your medical career will be affected. When that is affected, immediately your thought will be like, I was talking to that girl yesterday. I was talking to that guy yesterday. That is why my marks are, affected. So he is the problem for all of my, failures in medical career. So that kind of thing, the thing that you actually did it, the relationship for which you spent so much of time and energy instead of concentrating on your career, is itself becoming a poison. And now when your career goes down, you are blaming this relationship, and the relationship is going to take a strain. So that is also important. So when you are in, let's say you are preparing for your NEET PG again, or your exam, and they want to come and meet you, etc., it's okay to set boundaries and say no, and tell that no, I'm preparing, I will lose my momentum if I come out, so let me prepare, we'll meet at the weekend or when I'm taking the break. I understand, just talk in an effective way and find that work-life balance, right? And at the earlier age, because that is important skill for your entire life, right? So this video was to show how effectively this girl communicates, even though it's looking like a comedy scene, but she actually communicates, this is the kind of person that I want, and you are not that kind of a person, so I don't want you in my life. So that is the kind of clarity that you need in relationships, right? So you identify the stress, use all of these coping techniques, achieve an emotional balance, and prevent negative outbursts, because these negative outbursts are the seed for depression, anxiety, even in vulnerable individuals, psychosis, and for most individuals, these are the seed for drug abuse, alcohol, because they use this to, suppress that pain. So this emotional regulation is important to prevent all of these major psychiatric disorders. Right. Again, just like how self-awareness is important, when you use empathy, you also identify stress in your peers, in your partner, in your friends, and you either talk to them, give them the space, or help them understand that you're going through certain stress. Let me be there for you. Let me help you through it. So that kind of stress recognition in your partner also is important, right? And like I told you, every relationship is going to have a conflict. There is no relationship where there is no conflict. If there is no conflict, I don't think you are in a relationship at all. But the point is how you handle these conflicts, how you resolve these conflicts. You certain communication techniques. You don't say things like, okay, you did not pick up the phone, you did not come to meet me, you did not wait for me for lunch, you did not, gift me for Valentine's Day, you did not do this. Instead of blaming, use these statements. I expected you to gift me on Valentine's Day, that did not happen, so I am disappointed. You are talking about yourself instead of blaming that partner. This kind of communication strategy. I was expecting you to join me for lunch today. I thought you will join me for lunch today. So I am disappointed that you did not join me. That is why I am sad. So this kind of I statements actually resolves a lot of conflicts. That person will not feel attacked. You're like, nee enkuda lunch ku varala sonna, it will feel attacked. Okay, I had certain problems. Why is she not understanding? Instead of that, I thought you joined me for lunch, but I'm disappointed. Can we at least have dinner today? So that kind of communication techniques will help in conflict resolution. And always don't be like, nee annik apdi panna, like you did that today, you did that way. On first day, I know you did this. Now we are ending college and you are still remembering that. No, don't talk on about the problems again and again. Have a solution focused mindset. What can we do today? What can we do from now to improve our relationship, to improve ourselves, to prevent anything from happening to us? Also, work with them for a collaborative solution. Right? It is you against the world. You both are in a team. It is not you against you. You and me, you're not enemies. You both are in the same team. So that kind of solution focused strategies will also help. Again, direct approach, early intervention. Some people are like, இன்னைக்கு Sunday, I have to talk and அதை solve பண்ணலன்னா I will not be able to sleep. So that kind of thinking some people have. Some people are like, okay, today இன்னைக்கு Sunday, if I talk about it, it will lead to a very big disaster. Let me avoid it. So identify what your partner's type is, and also identify what your kind of type is, and make sure that it is not in conflict with each other. Talk about it when you are not in a conflict. எனக்கு இப்படி இருக்கு, உனக்கு இப்படி இருக்கு. How shall we resolve our conflicts? These kind of conversations help in a mature relationship, right? And other than that, your own emotional awareness, again, like we already said, எனக்கு கோவமா இருந்தா I might it's very common these days to utter all these bad filthy words. So I've had some patients who come and say, ma'am, I just asked that person, hi, how are you, where are you from, because all these people are from hostel. There was this girl who said எந்த ஊருன்னு கேட்டேன். So அது தப்பு. That became a very big thing. Why? Because you don't introduce yourself like that these days, it seems. So you have to use certain bad words and then you introduce yourself. Only then you are considered of the same generation. Apparently, I do not know. But these kind of emotional awareness of what you are, what the other person is, will help in their conflict resolution. So, this person talks a lot of filthy language, and you are a person who are not exposed to a filthy language, and you're like, oh my God, how can he tell all of these things? But in a different angle, even though that is wrong and everything, from a different angle, that is how that person expresses anger. Right, let me just take a back seat and then talk to him later about using these languages. So that emotional awareness is also important. So direct approach is not like this. Right, direct approach is not this. Violence is bad from either of the sides, right? So direct approach also involves using considerate language, right? And another important thing, comparison. We all keep saying, my parent compared me to Sharmaji's son. அவங்க பையன் எப்படி இருக்கான், அவங்க பொண்ணு எப்படி இருக்காங்க, உங்க தங்கச்சி எப்படி இருக்காங்க, உங்க அக்கா எப்படி இருக்காங்க, you are doing medicine, your sister is already in a what to say, OG or whatever. So all of these things, comparison, we don't like. Nobody likes this, right? You don't like to be compared. But when it comes to a relationship, you keep doing this. You know that person's girlfriend did this for him. Why are you not doing? You know that person's boyfriend planned a trip. You are not doing this to me. They gave this gifts. You're not doing this to me. You know, not everybody is the same. Everybody's love language is different. Everybody's financial status is different. Everybody's emotional bandwidth is different. Some people can be very expressive. Some people will spend a lot. Some people will not be in a position to do that. But still, it varies. You fell in love with that person for a reason. If you're going out with that person for a reason, identify that reason, stick to that. avoid comparing. That also creates a toxicity in relationship. And last but not the least, very importantly, time management is very, very important. Ma'am, என்ன ma'am சொல்றீங்க? We are talking about relationship. You are talking a relationship related webinar, and you are talking something like a motivational speaker. Why is time management important in a relationship? No. When you either give no time for the relationship, like let's say you are in a very that place where you're preparing for your NEET PG, and even talking to your girlfriend is going to affect your preparation, and you're not giving her even 5 minutes of your day, that also puts a strain on your relationship. That in turn will put a stress on yourself and the partner. Or you are in the opposite phase where you spend so much of time on your relationship and you're not spending enough time on your other things, because of which again your relationship takes a hit. So always time management is important. Classify task, prioritize it. Look, this is called Eisenhower's matrix. Is one of the things that you can use for time management. What is urgent and important has to be done immediately. What is important but not urgent can be done within today. What is urgent but not important, what is neither urgent nor important, it is important to give its own share of time. This is how you have to prioritize, right? You have to prioritize task, and something like this. Sorry.
Yes, ma'am.
Right, sorry, something got stuck. So you have to use this, something like this. So it's a task of high importance and high urgency, like completing a work project, like completing your, let's say, your observation or your record notebooks for your practicals, etc. That has to be done immediately. Preparing for a seminar, that has to be done immediately. Give importance to that. Respond to other messages, etc. later. Organize your task in your own free time. Also prioritize time for your family and other relationships. So this kind of social interaction planning will give you a better sense of control over relationships, because some things are uncontrollable, some things are controllable. This is one part of controllable things. Right. So this is an example of a breakup, right? So we have come to the point where, see, relationship, as of today, we are trying out things. We are looking if this person works for us. Hopefully, they stay with us for lifelong. That is the hope. But since this is a trial period, right, this can also end in a breakup. So this kind of anticipation is also important. There is a possibility of breakup in every relationship. Even after marriage, this is a possibility. So always, it's not like, okay, will they leave me? Will they leave me? And the fear of abandonment, salala. To have a mature sense of anticipation, which is a mature defense mechanism, which you can anticipate, okay, things are difficult, maybe we should break up. That kind of thinking will help you to, at least, I'm not saying easy, make it easy, but at least, lessen the burden of emotional things in a breakup, right? So just to, tell you how, it is very, very difficult. If you've undergone a breakup, there is nothing as hard as it. I can understand, right? But also, it is not as hard as you imagine it to be. At that particular point of time, let's say today morning, if my boyfriend has broken up with me, today, tomorrow, even for 1 week, I will feel like this is the end of the world. This is the time when people attempt suicides. This is the time when people go into drugs, do a lot of, unimaginable things which they do not usually do. But this pain is so unbearable. It is almost equivalent to somebody's death. Like as a close family member dies, how painful it will be. This is almost equivalent or even worse than that, because that kind of affection and affair that you had in your heart is gone down, right? And that person is saying that no, this is not going to work out anymore. So this is going to be painful. The point is, you need to acknowledge that pain. I understand I am undergoing pain. It's okay to cry. It's okay to, do certain just cry it out, or watch a motivational movie, or listen to sad songs and cry, etc. It's okay to do that. Just acknowledge that you're going through this. I'm going through this because this is a breakup, this is painful. It's okay. Have some self-compassion. During the end days of a relationship, during a breakup, you would have done things that are stupid. You will be like, you would have used various bad words to that particular partner. You would have sometimes gone and begged, just give me one more chance. That kind of begging can also have happened in during a breakup. Then you will feel so guilty. So I am such a person, how did I go and fall on his feet or her feet? So practice self-compassion. It's okay. You are in that kind of situation where you wanted that person to not go. So you did stupid things. It's okay. Acknowledge your feelings. Practice some self-compassion. Be kind and gentle. It's okay. And most importantly, this is a wound. I keep telling. See, breakup is a wound. You know what a monkey does to the wound? It goes on scratching the wound. The wound never heals. The same way, after undergoing a breakup, going and looking at his profile photo, her Instagram page, her Facebook page, checking who is she online or not, what was the last scene, etc. All of this is like pricking that wound. Limit contact as much as possible. In fact, block them everywhere, at least for 3 to 6 months or a year, until you move on and this breakup has no impact on you. After that, even if they come back into your life, it will not be so intense. The pain will not be so intense. You might have a little more healed. You will have a better handle over things. So limiting contact is very important part of healing after a breakup, right? And again, more importantly, this is the time when you look for other relationships. I told you, right? Romantic relationship has consumed everything. Don't do that. But still, when it is a breakup, look for all of these relationships. Look for your friends. Look for your family. Talk to them. Talk to them that you are going through this pain. Let them be there for you. Let them help you. Let them, you are almost, it's like you're sick. Right? It's like you're sick. You're mentally sick because of this breakup. So let them help you. And breakups need not always be a bad thing. Use this space to reflect and learn about yourself. What went wrong in this? How can I be better? And use this negative energy to do something positive in your life. That is called as sublimation, which is a very mature defense mechanism which people use. After breakups, there are people who have been directors, film directors. There are people who have been musicians. There are people who have been poets. There are artists. There are book writers. Right? There are people who went into the gym and became bodybuilders, etc. So this negative energy, so much you can spend it something on positive, and there'll be a beautiful thing that is coming out of it. And after, let's say, after a few weeks, it depends upon each person, few weeks, few months, or even a few years, you are definitely going to move forward. You are going to get better. The pain is not permanent, right? Pain is painful, and it looks like it is the end of your life at that particular point of time. But once you get through that tunnel, there is life after it, right? In the movie, they would have shown, even though it's not a typical breakup, the heroine would have died, but still he goes into drugs. This is how an immature breakup is. And also, this is also how a mature breakup can be. This is how sublimation works. So once you come out of that tunnel, there is still life, there still can be possibilities of love as expressed in lots of movies. So just to summarize, relationships are an essential part of life. There are many kinds of relationships. Each have their own role in life. Romantic partner need not necessarily replace every other relationship. When trying out relationships in these days, breakups are bound to happen. Anticipate it. Use effective coping strategies and use breakup as a phase of personal growth. Right? Understand yourself, your attachment style, use empathy, communicate well, resolve conflicts in a mature way, handle breakups well. Relationships are a part of life, not life itself. You are doctors. Use your intelligence to understand these nuances and navigate relationships better. Life will be better. Thank you so much for the opportunity. Thank you for patiently listening. Thank you.
Thanks a lot, doctor. We agree you are a great teacher. So it is like listening a lecture with a kind of comprehensive aspect of all the things. So thank you so much. We have 10 more minutes for question and answer. So anybody wants to ask questions, can open up the mic or post the question in the chat box. It's a very wonderful talk. Hope everyone would have benefited so much about it, not only the medical students, even in our day-to-day relationship and practice, it is very much useful and helpful. Thank you once again. So anybody wants to ask questions? Anything in the chat box, doctor? Just we'll see. The appreciation
There are no
is there so far. So good. Sir, Srinivasan sir, anything you would like to comment or ask?
I mean, there's an excellent talk. Hope a lot of youngsters have listened to it and got benefited. If not, probably group should try to post it on YouTube or somewhere so that it's accessible to most of the medical students as well. Because he has given a very, very practical and comprehensive, but but at the same time packed within about 45-50 minutes, starting from id-ego, superego to attachment styles to effective coping, self-awareness, a lot of things he has covered. And she has said probably after all these conflicts are bound to happen and how to solve conflicts. In fact, if they happen in a constructive way, if everything else fails, then how to cope up with breakup. Because like breakup is the most important problem in the youngsters nowadays, and most of them probably go to the even extremes of attempting or committing suicide. So that's where she has prepared. Even when you are in a relationship, when everything is going fine, still be prepared for a breakup. It might happen. So, I mean, if I have to sum up, it will take another 15 minutes. That's even if I pack it so much she has given, it's a wonderful, excellent talk, very, very useful. And at the same time, she has also given a lot of practical aspects like conversations, how it can go on and all that, and using Mentimeter again. One thing is probably you could have used the presentation in the Mentimeter, then the results would have come live. That's a small suggestion, that's all. So once you package the presentation itself in the Mentimeter, then whatever results, they will be live and it will be even more interesting to the audience. Of course, all kudos and nothing to.
Thank you, sir.
Thank you, sir. I think Suresh Kumar sir is there.
I don't,
So you would like to add or
I don't
comment?
know. Suresh is there or it's some other Suresh Kumar.
Don't know, sir.
Yeah, he will be at practice at this time. I don't think Suresh can be here.
Okay. Arul sir, anything you would like to say?
Yeah, at the outset, a very excellent presentation. Very so nice to hear, and it's the need of the hour. Not only medical students, all students, I think. And one point I may differ a little. That is, you expect a breakup even when you are in a relationship. So that relationship may not survive if we expect a breakup while in relationship. Okay, so I think my way may be different, and so believe in the relationship. If it breaks up, handle it. That may be the way I think. Anyway, best wishes. A very wonderful talk. So nice to listen to this talk. Really fortunate to listen to this talk, I think. Thank you. Right.
Thank you so much, sir.
Hello.
Yeah.
Yeah.
This is Dr. Vidya from Chennai.
Yes, sir.
I listened to the presentation. It was a wonderful presentation, Dr. Usha. Congratulations to you.
Thank you.
If you can just add upon identification of red flag signs in a relationship.
You want me to answer as a question, ma'am?
Yes.
So, given this talk, after giving this talk, and if you're able to understand certain attachment styles, so anxious avoidant or being clingy, that could be a red flag signs. Like I mentioned, in the beginning itself, if they start like, okay, now that you are committed to me, you have to dress certain way, you have to be certain way, you have to tell me everything that you are doing. Like even if you're going out with your parents, you have to get my permission. That kind of controlling behavior is definitely a red flag. And again, using violence even in simple ways in the beginning of the relationship itself has to be considered a red flag. And you know following, asking for your Instagram password, Facebook password, because I just want to know what you're doing. That kind of invasion of privacy has to be considered a red flag. And there can be many more, ma'am. I think this would cover this generation's things.
Yeah, thank you, Dr. Usha, because we see a lot of couples who have gotten into committed relationships and have failed to identify the evident red flags way back when they were, before marriage. And I think we'll have to educate uh, youngsters on identifying red flags as early as possible and moving out of the relationship, because our Tamil movies always portray that you will be able to change this person by being his mother, and you will be able to bring him out of the substance, bring him out of the toxic behavior. And we do see these kind of rugged men being portrayed as heroes also in recent movies, and violence being celebrated in Indian movies. So we need to educate people on identifying them appropriately. Thank you.
So
Thank
true.
you.
Dr. Usha, I have a question, a very practical venture. I mean, in my practice, I have almost 5 to 6 medicos, dentists, medicos. So their main problem is they are mature, they are adults, they have done their PG, they have started their practice. They are in a relationship, but still their parents are not okay for that. So they keep waiting. They have their own coping mechanisms. So initially, the one of the partners, either the girl or the boy, they come for the consultation. They having gone into depression and all that stuff. They come out of it. Then the other person also comes in. So in such cases where they don't see any difficulties, between these two, but they have issues with their parents who are not okay for that particular relationship. So how do you go about in those situations in your practice, Dr. Usha? That's also, it's a conflict, parents and here the partner, the relationship, and they come to us
Yes,
for
ma'am.
guidance.
I agree. That is a very common thing that we see in practice also, and even in colleges and every other relationship also. The point is, relationships are a Western concept. Like, I mean, even 20 years ago, maybe when you were all in college, if you fall in love with the guy, you're going to get married to the guy. That was the end, be all and end all, if at all that happens. But here now, that's a going out culture. Trying out things. If things are working out, not working out, all of this. So there are lots of dynamics. This is all a Western concept. Whereas, marriage itself, like how our parents think about it and how the family things portray, is a very traditional Indian concept. So this conflict, obviously, is there. And the point in how a couple can deal with it is to set boundaries. What is more important for them? This here is the hidden super ego conflicts. I want to be in this relationship, but my parents are not okay with me being in a relationship. So how good is your ego boundaries? How good is your defense mechanisms that you are able to handle? Are you able to convince your parents to agree to this? Or are you okay to go forward with the relationship and wherever it goes, despite your parents' disagreements? So that is also something you have to be okay with. Like it's something that has to happen. I have to get married to this guy, even if my parents are disagreeing. Then are you okay with that situation? So think about it in prior and use your own coping skills, etc., to understand this. And another thing is boundary. So your parents can have a say in certain aspects of life, and parents can't have a say in certain aspects of life. Obviously, this also looks like a Western concept, but this is how this generation's youngsters are, right? So we cannot be like, I mean, there are people who obey their parents and like everything I'll agree, etc., etc. But those people, then they have to be cautious in getting into a relationship, because anyway you're not going to have a fruitful outcome out of it. So if you understand that is kind of a person you are, then maybe avoid these things. Or if you are a really outgoing person, then put a boundary, tell your parents, no, this is my life, I have to do this. You can be okay, I'll be and be in my life. You can't be okay, my life will still go on. So it's not like eloping in marriage. I'm not encouraging that, but to have a healthy conversation and then going on. That is what I would say.
Thank you.
Anybody else? One or two more questions we can take, and then we'll wind up. Already it is 9:30.
On comment alone, we
Yeah,
see these
please.
relationship problems not only having a relationship but also between the married couple, right? They come for marital therapy, only maintaining the relationship, how healthy they are maintaining this relationship. It was an excellent talk between the Freudian principles like ego, superego, till the mature defense mechanisms, what you have spoken of. Now, half late, Dr. Bhagyashree pointed out that the parents as well as with the partners, one thing. And even between the partners, what happens is they get engaged. And when there is a gap between the engagement and the marriage, it is like 6 to 9 months. They speak whatever they speak, we do not know. We are not involved in that. That is the parents or the other people. They say that guy is not suiting me or this girl is not suiting me, so we'll go for a breakup. That because we are seeing some 4 to 5 persons. Madam, please let me know why this girl is telling no. And when we inquired that, maybe as you said, some silly things, right? One day he told that is she didn't give on message or some gift for the Valentine's Day, so he didn't remember about me. His work was so important for him, like that. And with one thing, she told, okay, right, I'll not do it. He's not caring about me. He's not remembering me throughout life. How he'll do it? So it's that sort of that emotionally unstable, no, that becomes really a problem even after you get engaged and it gets breakup. For the marriage it does not go. I've seen some 5 to 6 people like this. So it is very tough actually to understand why they become so emotionally stable and they are not thinking in the other people's angle. The attachment style comes here. Okay, why you should only think about me or something, or think that is the other partner. So that what that problem exists. And so I don't think when you have a good relationship or a mature relationship, their breakup is minimal. So it's not that much. Okay, right? When you are able to understand and when the relationship is healthy or you can understand the relationship, I think the breakup will be minimal. That you can point out. So after even that way, when there is some red flag signs, as you told, the breakup is imminent or it is inevitable, then handling it is comes then. Okay, that's what. That is the thing I want to tell you.
Thank you, ma'am. This in a mature relationship, obviously breakup need not be within themselves, but like how Bahishri madam told,
Yeah.
parents can induce a breakup. So in that
No,
time
but
also
that
we have to
happens
find a way to.
also sometimes. That happens.
Yes.
That's happening also.
Unfortunately, yes.
The what
Yes.
happens? Look, the problem is the thing is they don't. They accept the parents' thing, and what one guy told me, only the parents they didn't accept my love marriage, ma'am. Let the I couldn't do anything. After that, he didn't turn up. If you are going to speak about this again, I'm not going to turn up. The mother became very much depressed because she couldn't answer the other side, right? The girl side. So such sort of because you only asked me to marry this girl, you will live with that girl, and he's not coming home at all. So that sort of relationships also we are seeing. So it becomes really complex and tougher sometimes. Yes.
Thank you, ma'am. One more
Okay.
last question.
Thank you, Pa.
One
Thank
more.
you.
Yeah.
Though
One
for
more. Okay. One more last question. Our final word from Mr. President Sabrin, sir. Sir, kindly conclude. And after that, Abdul Rahman sir will give a vote of thanks.
A wonderful presentation. It was you maintained that flow, ma'am. Like you shifted from one topic to the next topic without any break. So I think you covered everything. Hardly anything left that was not covered. And it would be very nice if the medical students had asked some questions or raised doubts. but I don't think there were any questions or doubts raised by them. That's a little disappointing. So keep up this good work, and I congratulate the team once more and choosing this topic, coordinating this so well, and for choosing a very young speaker who is so passionate and doing a great job. Keep it up. Thank you, one and all.
Thank you, sir. Thank you so much. So we'll come to the vote of thanks final thing. Sir, Abdul Rahman, sir.
Good evening, everybody. First of all, I thank our President, Dr. Sabin, sir, and his Cabinet Committee. And also, I thank our committee members, Women Empowerment Committee members, all other members, and the chairman. And I thank our speaker, who was my student at Tirunelveli Media College, to Sanandani, for her wonderful speech. And also, I thank our seniors and juniors and friends who are participating in this webinar. Finally, I thank the East West Pharma for their providing the academic service. Thank you, one and all.
Thank you, sir. Thank you so much. So, Dr. Usha, you want to say anything?
Ma'am, thank you so much for the opportunity, ma'am. I hope I did justice to the topic because I did not know if it was what you expected. So I just
Still you have doubt, doctor? After so many compliments and this thing, still you have doubt?
No, I'm just saying because it's not a typical topic, no. So I did not know how to navigate it. I found difficult to navigate this relationship. So hope it
That's
came
where
out
the
well.
real challenge is, doctor, because when you're going to talk about a proper, something about biological issues and all that thing, then it's always, available. In these topics, your real talent comes out because you need to put out the points, you need to do the actual searching and all that, and it's very challenging. But it's a very useful topic. That's why we chose this topic.
As Sabita madam said, from the ego to this defense mechanism and everything you have covered in a very beautiful manner. So we should thank you very much. And so thanks for everyone for joining with us.